Bismillahirrahmanirrahim. In this video, I am going to discuss the features of accelerated idioventricular rhythm. Now, what is accelerated idioventricular rhythm? It's actually a rhythm arising from the ventricles, but the rate is between 50 to 110 beats per minute. In case the rate is less than 50 beats per minute, it's called a ventricular escape rhythm. And if the ventricular origin beats are there and the rate is more than 110 beats per minute, it is called ventricular tachycardia. But a rate between these two extremes, that is from 50 to 110 beats per minute, it is called accelerated idioventricular rhythm. So this is one feature. The other feature is that the complexes are regular. The third feature is there must be more than 3 consecutive beats in a row or in the rhythm strip or anywhere. There must be more than 3 consecutive beats with ventricular nature. They must be visible. And the third point is the QRS complex that must be more than 120 milliseconds. And the fourth one is there is presence of fusion and capture beats. Now we will be discussing the ECGs with examples. So here is the first ECG demonstrating accelerated idioventricular rhythm, and here the heart rate is almost 80 beats per minute, and we can clearly see, just look at V1, V2, V3 in this ECG, and note the wide QRS complex, and also note the left rabbit ear of the QRS complex, especially in lead V1 and V2. The left rabbit ear is taller than the right rabbit ear, and when the left rabbit ear is taller, it actually signifies that the complex is originating from the ventricle. Same is the case with ventricular tachycardia, but as we have already discussed, that in that case the heart rate is more than 110 beats per minute. As in this ECG, the heart rate is between 50 to 110 beats per minute. It is called accelerated idioventricular rhythm. Similarly, in this ECG, the rate is somewhat more than the previous one. It is almost 90 beats per minute, and same features they are present here. The wide QRS complex, that is more than 120 milliseconds, plus the heart rate is between 50 to 110, and there are more than 3 consecutive ventricular origin beats. Just look at the rhythm strip on the lowermost line. There we can see 4 consecutive ventricular nature beats followed by 2 sinus beats, or these are also called capture beats. Now coming to the etiology of accelerated idioventricular rhythm, it's most commonly seen in case of reperfusion, when there is acute myocardial infarction and we are reperfusing the artery either with primary PCI or fibrinolysis. Usually we can appreciate accelerated idioventricular rhythm in that case. The other reasons of this rhythm can be the use of beta agonists, or ongoing ischemia, or some drugs can also cause this, like digoxin, and some other conditions like cardiomyopathy or myocarditis. These are some main features. These are some main etiologies of this arrhythmia. And now coming to the treatment, it is mostly it's self-limiting. So we must be focusing on the underlying cause to treat this. So I hope you like this video and it was beneficial. Thank you very much.